Welcome to the Victory Education Lounge. I'm your host, and today we're diving deep into a topic that affects millions: gout and insulin resistance. This is part 93 of our ongoing series on metabolic health. Before we begin, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this vital information. Many people don't realize the significant connection between gout, a painful form of arthritis, and insulin resistance. Whether you're dealing with gout, want to prevent it, or simply aim to optimize your overall health, understanding this link is crucial. Today, we'll explore how insulin resistance affects gout development and progression, and discuss solutions, management strategies, and prevention methods. Did you know there's a significant connection between gout and insulin resistance? Yes, you heard it correctly. These two health conditions are more closely linked than you might think. Let's take a moment to break down what each of these terms mean. First, we have gout. Gout is a type of inflammatory arthritis that can cause extreme pain, tenderness, redness, and inflammation in your joints. It occurs when urate crystals accumulate in your joints, causing the inflammation and intense discomfort of a gout attack. Urate crystals can form when you have high levels of uric acid in your blood. Now let's talk about insulin resistance. This condition happens when your body's cells start to resist the effects of insulin, a hormone that regulates the movement of sugar into your cells. When this happens, your body needs higher levels of insulin to help glucose enter your cells. As a result, your pancreas makes more insulin to compensate. Over time, this can lead to higher than normal levels of insulin in your blood, a condition known as hyperinsulinemia. So how do these two conditions intersect? Well, insulin resistance can lead to higher levels of uric acid in the blood. This is because insulin helps your kidneys get rid of uric acid, so when your body resists insulin, it can lead to a buildup of uric acid, potentially triggering a gout attack. Moreover, insulin resistance and hyperinsulinemia can lead to other health conditions such as type 2 diabetes and metabolic syndrome, which are also associated with an increased risk of gout. So, it's a bit of a vicious cycle. Understanding this connection between insulin resistance and gout is the first step towards effective management and prevention of these conditions. This knowledge can empower you to make informed decisions about your health and lifestyle choices. You may wonder, how does insulin resistance impact gout? Let's delve into this. As we progress in this series, we'll explore the various ways insulin resistance can influence gout development and progression, and the strategies you can adopt to manage these conditions effectively. But for now, remember that knowledge is power and you're already on the right track. Insulin resistance can lead to increased uric acid production in the body. This statement might seem simple, but it holds the key to understanding one of the primary connections between gout and insulin resistance. So, how does this happen? Well, when our bodies become resistant to insulin, it leads to an overproduction of uric acid. This uric acid is a waste product that's typically filtered out by our kidneys and excreted through urine. However, when there's too much of it, the kidneys can't keep up, and this excess uric acid starts to form crystals in our joints, leading to the painful condition we know as gout. Now that we know the problem, let's talk about the solution. One of the most effective ways to manage uric acid production is through a low-purine diet. Purines are substances found in many foods, and when digested, they break down into uric acid. So, by limiting high-purine foods like certain meats and seafood, we can help reduce the amount of uric acid in our bodies. But diet isn't the only weapon in our arsenal. Lifestyle changes aimed at improving insulin sensitivity can also play a significant role in managing uric acid production. Regular exercise, maintaining a healthy weight, and getting enough sleep are all powerful tools to increase insulin sensitivity and, in turn, decrease uric acid production. To illustrate the impact of these strategies, let's consider the case of John. John is in his early 50s and suffered from frequent gout attacks. By adopting a low-purine diet and incorporating regular exercise into his routine, he was able to reduce his gout attacks by 70% within 6 months. John's story is a testament to the power of dietary and lifestyle changes in managing gout and insulin resistance. While managing uric acid production can be challenging, it's a crucial step in preventing and managing gout. So remember, a low-purine diet and lifestyle changes aimed at improving insulin sensitivity are your best allies in this fight. Insulin resistance can also impair the kidney's ability to excrete uric acid. This is an important aspect of understanding how gout develops and progresses. When the kidneys struggle to remove uric acid from the body, it starts accumulating in the joints, leading to painful gout attacks. So how can we manage this situation? One simple yet effective strategy is to stay well hydrated. Water aids in flushing out toxins, including uric acid, from our system. Regular consumption of water throughout the day can help the kidneys to function better and eliminate uric acid more effectively. However, in some cases, hydration alone may not be sufficient, especially when dealing with severe insulin resistance. That's when medical intervention might come into play. Certain medications can assist the kidneys in excreting uric acid. Of course, any medication should only be taken under the supervision of a healthcare professional. Let's consider a case study to illustrate this point. Meet Sarah, a 48-year-old woman with persistently high uric acid levels. Despite her best efforts with diet and exercise, she was struggling to bring her uric acid levels down. After consulting with her doctor, she increased her water intake to 3 liters per day and started a medication to support uric acid excretion. Over the course of 3 months, Sarah saw a 30% decrease in her uric acid levels. Of course, every person is unique, and what works for one might not work for another. The goal is to find a strategy that fits your lifestyle and medical needs. For Sarah, a combination of adequate hydration and medication was the key to managing her uric acid levels and reducing the frequency of her gout attacks. It's worth noting that while managing uric acid excretion is important, it's only one piece of the puzzle in managing gout. It must be complemented with other strategies such as a low-purine diet, regular exercise, and maintaining a healthy weight. Addressing uric acid excretion is another key strategy in the fight against gout. A holistic approach that includes multiple strategies will give you the best chance at managing this painful condition and improving your overall health. Did you know insulin resistance promotes chronic, low-grade inflammation, exacerbating gout symptoms? This might sound a bit complex, but let's break it down. Inflammation is the body's natural response to injury or infection. However, when inflammation becomes chronic, it can lead to a host of health issues, including gout. Insulin resistance, characterized by the body's inability to use insulin effectively, triggers this chronic, low-grade inflammation. This inflammation, in turn, worsens the symptoms of gout, a form of arthritis caused by the buildup of uric acid crystals in the joints. It's a vicious cycle that can significantly impact your quality of life, but there's good news. You can manage and even reduce this inflammation through some strategic lifestyle changes. Let's explore some of these strategies. Firstly, adopting an anti-inflammatory diet can play a significant role in managing inflammation. This diet includes foods rich in omega-3 fatty acids, antioxidants, and fiber. Think fatty fish, berries, nuts, seeds, and leafy greens. By contrast, try to limit your intake of processed foods, sugars, and unhealthy fats, which can trigger inflammation. Regular exercise is another key strategy. Physical activity helps lower inflammation, reduces uric acid levels, and improves insulin sensitivity. Whether it's a brisk walk, a swim, or a yoga class, find a form of exercise you enjoy and make it a part of your daily routine. Lastly, don't overlook the importance of stress reduction. High stress levels can exacerbate inflammation and gout symptoms. Techniques such as mindfulness, deep breathing, yoga, or even a hobby you love can help manage stress levels. Let's consider a case study. Meet Mike, a 55-year-old man who experienced severe gout flare-ups. After adopting an anti-inflammatory Mediterranean diet and starting a daily walking routine, he saw a 50% reduction in flare-up frequency within 4 months. His story is a testament to the power of lifestyle changes in managing inflammation and gout. Managing inflammation can not only help control gout, but also improve your overall health. Remember, every step you take towards managing inflammation is a step towards healthier, pain-free living. Excess weight and metabolic syndrome, both often associated with insulin resistance, increase the risk of gout. Let's talk about these 2 factors, starting with weight management. When you carry excess weight, your body's ability to regulate insulin often decreases, leading to insulin resistance. This in turn can exacerbate the production and accumulation of uric acid, paving the way for gout. But the good news is, managing your weight can help mitigate this risk. A calorie-controlled, nutrient-dense diet coupled with regular physical activity can be instrumental in maintaining a healthy weight and improving insulin sensitivity. Take the case of Lisa, a 50-year-old who is overweight and frequently suffered from gout. By committing to a nutritious, balanced diet and incorporating physical activity into her daily routine, she managed to shed 30 pounds over 6 months. This weight loss correlated with an impressive 80% reduction in her gout attacks, underscoring the power of weight management in controlling gout. Now, let's shift our focus to metabolic syndrome, a cluster of conditions like high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. Metabolic syndrome is closely tied to insulin resistance, and you guessed it, it increases the risk of gout. Managing metabolic syndrome involves a comprehensive approach that addresses all aspects of metabolic health. This includes embracing lifestyle changes like a healthy diet, regular exercise, stress management, and cessation of smoking. Regular health checkups and monitoring are also crucial to keep tabs on your metabolic health. Consider the case of David, a 58-year-old who had gout along with other markers of metabolic syndrome. By adopting a holistic approach towards his health, making significant lifestyle changes, and staying regular with his checkups, David was able to manage his gout and improve his overall health. As we've seen, addressing weight management and metabolic syndrome can significantly reduce the risk of gout and improve overall health. So, let's take charge of our health, one step at a time, and move towards a gout-free life. Remember, managing gout in the context of insulin resistance requires a comprehensive approach. By addressing both conditions simultaneously, you're not just reducing gout attacks, you're enhancing your overall metabolic health and well-being. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Your experiences could help others on their journey to better health. Disclaimer. The information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decisions, especially those related to gout management and metabolic health, should be discussed with a licensed physician or qualified healthcare professional.